And welcome to Sugar Talk with Dr. K. Jean Lucas and Diabetes and Endocrinology Consultant. And good morning, Doctor. How are you?
Good morning, I'm great.
All right, what are we talking about today?
The feet.
Feet.
The agony of defeat.
Feet don't fail me now. All right. Okay, and now that we have any other puns you want to throw out there, sayings about feet?
Yeah, it's too early for too many.
All right. For diabetics, the feet really are important.
Yeah, and I think most people know that. I think if you have diabetes, you worry about the feet, you worry about people that have had amputations in your family, and you don't want to do that. So there's a reason that the feet are important, the reason that they're affected by diabetes the most. One thing is they're way down there, They're down at the bottom of your legs, and they're pretty far away. So the blood vessels that go to the feet and the nerve endings that go to the feet are pretty long, and they get smaller and smaller. And those are the ones that get affected first, probably because they're the smallest, probably because they have it's a long nerve that goes there. But sugar sticks to those nerve endings. So when sugar sticks there, the nerves can't do their job. The nerves send out the wrong signals. And sometimes it's caused by the sugar just going up real quick, and people feel tingly, or sugar going down real quick. And they'll feel tingly when that happens. So the feet will feel like pins and needles sticking in them. That's what people describe, or tingling or burning. A burning sensation might go into the feet. Usually it's at the bottom of the feet. It can be the whole foot. It seems to be worse at night when you take pressure off the bottom of your feet.
Oh, really?
So if you stand up during the day, which most people do,
that's actually
helps to put pressure on the feet and sort of inhibits those abnormal sensations. Sometimes even wearing socks at night, which puts a little pressure on the feet, helps that burning and tingling at night. But if you have that and you don't have diabetes, then you may actually have diabetes undiagnosed or pre-diabetes, because the nerves are damaged even with the mildest of blood sugar elevations.
You mentioned about the socks. You could have special socks, right?
Well, it doesn't have to be special socks, just any sock. I mean, you don't want to have constrictive socks, but it's just more that you put a little bit of pressure on your foot, and it confuses the nerve a little bit, so it doesn't send out as bad of signals. Now, it may not work on everybody, but if you have really mild problems at night, then that may help a little bit. But the sugar sticks to the nerves. It also sticks to the blood vessels in the feet, and the blood vessels are very small by the time they get down to the toes. So having blood vessel problems in your toes creates problems too, because you're not getting circulation down there. And the feet take all kinds of abuse. You stub your toes.
Sure. Yeah.
If you have neuropathy and you can't feel where you're stepping or feel anything that sticks in it, you can get injuries without knowing it. And how many people look at the bottom of their feet? It's not like something you do every day.
It's not easy.
It's not easy. Especially if you're overweight, it's hard to get the knee bent and see the bottom. So some people recommend using mirrors, like a little mirror on the floor, hand mirror, to look at your feet every day. And that's really important. You're looking for any kind of redness, like rubbing. You're looking for calluses, breaking of the skin, rashes. People get ulcerations or blisters. They'll get blisters first, then the blisters will go away, and they'll have a little crater in their foot, and that's prone to get infected. And that's where a lot of the amputations come from, is they get a severe infection and then not have enough blood flow to help it, to get the antibiotics down there, or just not being aware of it. It gets bigger and bigger because you don't feel it. If you had an ulcer in your foot and you had normal sensation, you would feel it and you get help immediately. But if you don't, if it's at the bottom of your foot that you never look at, it can get bigger and bigger over time. That's why we tell people with diabetes, don't wear new shoes for very long without looking at your feet, like the whole foot, because they can wear blisters.
So even the blisters on your heels.
Blisters are bad. Blisters are bad for people with diabetes because they can turn into ulcers and not heal. And so that's why we want to protect the feet in diabetes. That's why we keep emphasizing looking at your feet every day, getting a mirror, looking at the bottom, making sure you don't get neuropathy.
Sounds like foot massages would be going.
Foot massages are good. In fact, if you have your spouse that can massage your feet, they can look at your feet while they're massaging it, and that would help you more. Look between the toes. You don't want to soak your feet usually, because it creates the skin gets real soft and cracks open, and that's when you get infections. People with diabetes get more fungal infections in their feet, which causes a little rash and scaling, and prone to get bacterial infections too. So athlete's foot, for example, which is a fungal infection of the feet, is more common in people with diabetes. The fungus gets in the toenails, makes the toenails thicker, and people don't like the look of the toenails, but it means that there is an infection in there most of the time. You can also get thickened toenails just from the circulatory problems, just not getting enough blood flow down there. But you want to take care of your feet because you want them to last your whole life, and you don't want the diabetes to affect them.
Now, I've often heard that you have to be careful about pedicures, the diabetics.
Yeah, you really don't want to cut your toenails rounded so they look pretty. You want to just cut them straight across. If you have somebody else do it, they need to be aware you have diabetes. But you don't want to cut your nails too close or down into the quick of the nail so you won't get an infection. So that's another thing. Keeping the toenails trimmed. You also don't want to have, if you have foot deformities like hammer toes or any kind of deformity in your foot, you probably need to see a podiatrist and get special inserts for your shoes so you won't create problems with the pressure on the abnormal part of the foot, the part that's abnormal.
Now that's pretty common, I would imagine. So,
yes.
Yeah. So again, so diabetics need to not only see you, but they also need to see a podiatrist, probably.
I think that's usually the best idea. The podiatrist can trim your toenails if they're thickened because it's very hard, you know. You had to get a chainsaw to trim your toenails, so it'll be bad.
Yeah.
And if they're that thick, a normal clipper is not going to take care of it. It's just going to be hacking away, and it's not a good thing because you could slip and injure your toe. So the podiatrists have really big clippers. Not really big, but they're strong.
Loppers like you use in the yard. Yeah, there you go. All right. Welcome back here on Coastal Daybreak on the talk station, FM 107 and AM 1240. And thanks for joining us here today for Sugar Talk with Dr. K.G. Lucas from Diabetes and Endocrinology Consultants, online at beachdoctor.com. And Dr. Lucas, we're talking about diabetic neuropathy and pain. Is it mostly feet, though?
Yeah, that's the major. There's other neuropathies, and we can talk about that another time. But for pain, if it's severe and it's keeping you awake at night, it's not good. So there's medications that sort of calm the nerves down, that tell the nerves you don't really feel pain. And they're not pain medicine. Pain medicine is not a good way of treating diabetic neuropathy because you just get addicted to the pain medicine.
Right.
And it's not real, and you really want to make the nerves better. You want to help them, and you don't want to just mask the pain. So one group of drugs is Neurontin and Lyrica. I think Lyrica is advertised on TV a lot about neuropathy, so it brings that to mind to people, that people, if they have neuropathy, Lyrica is the more expensive version of Neurontin. They're both similar, but Neurontin is generic, so it's cheap. But that, you take it at night, and it helps the nerve endings not send out the wrong signals. It just calms them down. So that's a good thing. And if that works, that's great. There's a group of antidepressants, old antidepressants, amitriptyline, that help too, and it also helps you sleep. So it helps you sleep and it helps the nerve endings. Cymbalta is the newest antidepressant that helps chronic pain and chronic nerve pain. So it really is probably one of the better ones as far as an antidepressant and an anti-neuropathy drug.
But what you said, that might be crucial, though. Some people may have some old pain medicine around, or just even over-the-counter pain medicine, but that's not what they should take.
Well, over-the-counter pain medicine is fine if it works. I mean, Tylenol's fine, Aleve is fine. Any of those, you want Aleve more than Advil because it lasts all night. So if all you have to do is take that or take Aleve PM, which has Benadryl to help you sleep, and that works, that's fine. I was talking about narcotic pain medicine.
Yeah,
you really don't want to start on the narcotics because, for one thing, they don't last all night, and unless you get the real long-acting ones. So I think we should try to stay away from pain medicine and try to find something that actually helps the nerve endings get better.
And then during the day, try to be on your feet.
Yeah, if it helps you, because most people don't notice it during the day. Maybe they're distracted, but it also helps to be on your feet a little bit. Keep your blood sugar well controlled. The better your blood sugar is, and the less excursions up and down, the less symptoms you have, and that's true even if you have early diabetes or pre-diabetes. You want to avoid the carbohydrates like we were talking about, a lot of starches and sugars, and try to keep your sugar as perfect as possible, and that helps the nerve endings also.
If a diabetic is on blood thinner, does that make a difference?
No. I mean, the blood thinner helps the blood flow, so they get a little bit more blood flow, although the problem with the little blood vessels are plaques. plaques building up in the little blood vessels, inhibiting the flow of blood to the toes. And that's not the neuropathy. We're not talking about circulatory problems as far as the tingling and burning. That's neuropathy. But if your legs hurt when you walk, that means you're not getting enough blood flow to the muscles. That's a circulatory problem. Or if your feet turn blue or white when they're cold or cramp, it may be a circulatory problem. So that's another thing to look into.
You want to find out more, you can go online to beachdoctor.com to find out more about diabetes and endocrinology consultants. And again, beachdoctor.com.